So we're here with Dr. Chavez, a dentist. Dr. Chavez, you're in Woodland Hills, Southern California, where the sun never sets, right?
That's what they say.
That's what they say. Well, Dr. Chavez, tell me a little bit about dentistry. In fact, here's something about us patients who go to a dentist or to a doctor, any doctor for that much. We, on one hand, we feel like a dentist is a dentist is a dentist. You all go to a particular school and everybody learns everything and you have to comply with very strict, rules. Otherwise, you lose your license. At the same token, we also feel like there are different types of dentists out there and we don't sometimes know what that is. We're looking for a match, a little bit like finding a soulmate in a marriage. So tell us a little bit, what can patients expect in your practice? Is a family with their kids welcome? Are elder people welcome? Is somebody welcome who just needs a little bit of, fixing up, even though he might have a lot more work to do, but financially or so he cannot quite do it? Is somebody who wants a nice Beverly Hills smile, $1 million smile, is he welcome in your practice? Tell us, and while you're at it, Dr. Chavez, tell us, what made you become a dentist?
Well, boy, quite a few questions. Let me start from addressing your first statement. Dentists are not all the same. Dental school prepares you and gives you the basic skills to start taking care of people. But education is an ongoing, lifelong adventure. And your clinician really needs to be committed to education and continued education, especially in these times, because science is moving so fast. The science of dentistry has moved so rapidly. It's unbelievable. When I got started 20 years ago, we were using second generation porcelains. Now we're using seventh generation porcelains and adhesives. And that's just in 20 years. We'll probably be using 14th generation in adhesives and porcelains in the next 10 years. So it's unbelievable, the curve. And your clinician really has to have a passion for his career and for what he does, and he needs to be a lifelong student. Our office is a general family practice office with an emphasis on cosmetics. I love dentistry, and I really love all the phases of dentistry, and we actually are able to provide in our office for pretty much every single phase of dentistry. And so regardless of what your needs are, whether you need wisdom teeth extracted, whether you need gum disease-related treatment, surgeries, laser dentistry, if you have issues with sleep apnea, you name it. We are able to address implants, sinus lifts, bone graftings. Whatever your issues are in dentistry, we can pretty much address them all under one roof, which has been a great blessing for our patients because in the times that we live in, people have a hard time having to be referred. Let's say you need a root canal. You're being treated, and lo and behold, we find out that the decay got to your nerve and you need a root canal. In many offices, we have to stop the procedure. Of course, you're half open, you're in pain, you have to stop, and then have to call another professional. He then has to try to fit you into his schedule. You got to fit him into your schedule. So many times it's a week and a half later, sometimes 2 weeks later. And now you are sitting with this tooth that's hot, that's bothering you, keeping up at night. Then finally you have to go to this other office. Then you have to start through the acquaintance, the relationship phase of having a new clinician take care of you. You have to kind of make sure you're feeling comfortable with them, create financial arrangements. They don't know you from anywhere. They expect to be paid up cash. You and I have a 20-year relationship. I know that you can make payments to me because I know you well. I know your husband. I know your children. But this other specialist does not. So all these other inconveniences we're able to help you avoid. So under one roof, regardless of what your issues are, we usually can address them all.
And that's obviously something people with no doubt, will like, because you mentioned, all those points which are uncomfortable, and even if it's just the driving and finding a new parking space in a new place, which again in Southern California couldn't be all that comfy from what I hear. So I got that, and it's nice to know, it's nice to hear somebody saying that, we keep thinking of dentistry as something which has always been the same way. And so what you're saying is the rule of what worked for our grandparents and parents must be working still. A dentist who has that attitude just simply will not do a good job anymore. He will do a good job if you put him back into that time, but it will not be good for today's. He's not using tools available. That's what you say.
Yes, I would certainly be reticent to suggest that any particular dentist would practice below a standard of care. But we're not striving for standard of care; we're striving for excellence.
Right.
So to that end, it's not just were we able to take that tooth out of your head, for example. We want to make sure we use minimally invasive techniques. We want to make sure that you had close to no pain throughout the entire procedure. But not only that, we also want to make sure that once you leave us, everything we've done and the procedures we took and the way we've manipulated the tissue, etc., will maximize the chances that you leave and you're actually doing quite fine. You can actually leave and go to work the same day or the next day. And that's all got to do with technology, with techniques, evolving understanding of dentistry and the way to take care of people.
Right. Yeah, it's beautiful that not only computer advanced. So what made you becoming a dentist?
My dad was a missionary, and I grew up actually in Africa, in South Africa, and had an amazing dentist as a child in Johannesburg. This gentleman was very, very interesting, and he had this amazing staff. And the staff was always very friendly, and they all knew Johnny, and I'd come in, they'd all make a big party about Johnny, and they'd all hug me and kiss me. And his name was Dr. Murray. And he was this was a long time ago because, this is the early 1970s. This is, my first memories is like 1971. I was about 6, 7. And in those days, dentistry hurt. There's no getting around it. It's the old foot pedal and especially it was still Africa. But he never lied to me. He'd always tell me the truth. He'd say, Johnny, this is going to hurt for about the count of 5. Then you're going to be okay. Well, this will hurt now, but then you're going to be fine. And he never lied to me. He always told me the truth. He did not try to sneak something on me. And so I really trusted him. And, the things that he did occasionally would be uncomfortable, but he would always be upfront about it and tell me before. And so he had this air about him that was honest and trustworthy. And although I knew he would do things to me that occasionally I wouldn't enjoy as much, but I knew I was safe with him. And then he had fought in the Second World War against Rommel and in North Africa. So when I'd come in, he'd be telling me stories about the battles in North Africa. And lo and behold, he'll be telling a story, and then a procedure will be done. And said, and then Johnny, we came over the hill. Okay, so next time we'll talk about what happened after we came to the top of the hill.
He really hooked you to dentistry, huh?
Absolutely. I would So I would totally remember it, okay? And I would always be so amazed that I'd come back and he would start, okay, Johnny, so we got to the top of the hill and there was Rommel and his forces. And I'd be so amazed that must have been the most important person in his entire practice because he would keep this in his head, of course, right? Of course, now I know he probably put it in the chart, kept it at the top of the hill. But for me, it was always amazing that I was so special to him. Anyway, bottom line was, he was a very positive person. He seemed to have a great life, and he had a passion for his work. He was always surrounded by by lovely ladies and fun people, and there was a lot of laughter, and it seemed like there was a lot of happiness in his environment. And I kept thinking, he seems to be having fun all the time. And it sparked something within me. And in my family, the men are all either pastors, missionaries, or they're MDs, missionaries. And I wasn't cut out to be a pastor, and I didn't particularly want to be an MD, but this seemed to be something. And then I took aptitude tests in university, and they said, you'd be a wonderful dentist. They test your mental dexterity and personality types, etc. And they said you score very, very highly, and you should really consider this. And it was a natural fit for me.
You guys, you dentists, you really, there's a huge clinical and mechanical part to it, like with an MD or a super high-class engineer or something. But at the same time, you guys are more artists than anyone else because, a front tooth which has the exact millimeters of measurement doesn't necessarily look aesthetic still on that person. There's a little more to it, isn't there?
Yes, yes. There's a lot of artistry in dentistry. I personally used to enjoy sculpting and specifically in wood. I used to like to whittle away wood and create animals. And I grew up in Africa, so I've made many elephants. And let me tell you, it's not as easy as you may think. Especially when you have them like running. You got one leg forward, one leg back, one leg forward, one leg back. You got a block of wood, and then you got to imagine it in 3-dimension. And then create it. And you got to keep the proportions right. You can't have one long leg in the back that belongs to a giraffe in a buck.
And so, the dimensions right is probably a very key word for the mouth. Little too short, little too long, little too wide. It all makes a difference. It's like a good, a good fashion designer who doesn't put stripes on a guy or lady who's supposed to have jackets. Or what do I know? But you know what I'm saying? There's definitely something to it. Well, Dr. Chavez, it's really very nice to see that. I love it because I'm part of those people a little bit who, when people do something because of an experience they had, something they like, they follow somebody they admire, because when we do that, we automatically have more affinity for what we do, If the motivation wasn't, well, I think the newspaper said, the Wall Street Journal says in the next 20 years, that's the profession with the most money. I'm not saying that one couldn't and shouldn't make money. Obviously, it's part of what we do. But if the motivation of how, the why, something was in it, that's great. Well, Dr. Chavez, thank you very much for informing us about you and your practice. I appreciate it.